welcome back. So up for you right now, we have Dr. Yousuf Siddiqui. We're going to be talking about thyroid and autoimmunity. So Dr. Yousuf offers a non-judgmental and compassionate approach to resolving complex imbalances in the body. Initially trained in architectural science, Dr. Yousuf has spent the last 20 years studying traditional medicine. He believes that foundation of health is digestion, healing the microbiome, addressing SIBO, eliminating parasites, and improving nutritional absorption can have a cascade effect towards restorative health. His clinical focus extends to men and women's reproductive health, thyroid health, chronic fatigue, fibromyalgia, and metabolic syndromes. So welcome, Yousuf. Thanks for having this discussion with me today. So just turn on your camera and your microphone. Hi, make sure to unmute.
How are you?
So I think a lot of people are going to be really excited to have this discussion because I get this question so much. And we actually have a couple of questions in here that we will get to after around thyroid. Synthroid is the #1 prescribed medication in North America. Thyroid conditions are rampant. It's one of the most common conditions, especially for women. So I think this is a really, really relevant conversation for us to have. So I'm really interested to hear your point of view on your experience with thyroid disorder. So let's just get into that a little bit. What is your experience with thyroid disorders, and where do you see this fitting into the realm of autoimmunity?
Right. So first of all, Emma, thanks for the lovely intro and for hosting. Actually, this is awesome. So, as a naturopathic doctor, a lot of people who come into my practice are looking for answers. So they're typically, they've seen various practitioners, they've had lots of testing done, and no one's really getting to the root of what's going on. And, I think of myself as being a detective. So as a naturopathic doctor, I use a functional medicine approach. I'm trying to get to the root of what's going on. And in a lot of cases, there is an autoimmune component to it. And there's also a lot of chronic inflammation, which is also along the immune side of stuff. But when we talk about or think about the thyroid, a lot of us think mostly about fatigue and weight gain, those hypothyroid type symptoms. And I find that this is an oversimplification because the thyroid is responsible for a lot more processes within the body. And when there's autoimmune related issues, such as like Hashimotos or Graves' disease, it can create this kind of effect on the rest of the body. But what the thyroid also plays a key role in are other pro-inflammatory conditions like fibromyalgia, chronic pain, chronic fatigue syndrome. They also have definitely, the thyroid plays an integrated role into all of this, and as does the LDN. And what I find personally is that the thyroid plays this role and these conditions are overlooked.
Yeah, and I think this is kind of the theme of a lot of the conversations we've been having today, is this kind of back and forth relationship between certain conditions. The inflammation and autoimmunity drive the disorder, and then the disorder drives further inflammation and disruption. And so you kind of get these people stuck in this cascade of effects where they really, really can't get out, and they're so depleted and sick. It's really hard to even initiate therapies for them, especially when you don't know what you're trying to treat.
Well, exactly. And I think a big part of it is, how are we, what are our evaluation tools, right?
Yeah.
When someone comes in and they're like I'm not feeling well, I'm fatigued, or my body's in pain, what are we actually doing, to understand what's going on within the body itself? Why is that inflammation occurring? And then what can we do using our different modalities to help support, decrease the inflammation, and improve a person's quality of life?
So what are those tools that you're using in your practice if someone's coming in with, potentially a thyroid condition or a complex condition like this?
Yeah, so, because the topic on this is towards thyroid, I'm very it's really complicated. And as you know, Emma, you're a detective, just like I'm a detective. And then we get really excited when we're trying to sort through these things. And it's really, in the nature of what we do, it does open Pandora's box. And it's very It's not unilateral. It's very complex, integrated effects. But when we're talking about the thyroid, I think the thyroid's involvement is often missed because, I mean, Emma, you can I'm sure relate to this, but you get patients come in who are chronically fatigued or inflamed, and the only blood work that has been tested is their thyroid stimulating hormone, their TSH. And I probably see that in about 80% of my cases where the thyroid isn't really being fully addressed. So do you normally see around similar things?
Oh yeah, for sure. And I mean, I think there's desperation around thyroid because people are also grasping at something because they're like, I'm sick and my blood work keeps coming back normal, but there's something wrong. I'm extremely fatigued. They might have a diagnosis of fibro, but they have pain, but they don't have any energy at all. And so we know that obviously the thyroid is a piece of the puzzle, but we still need to evaluate it properly in order to understand what it is that's actually going on. So what type of specific thyroid testing then would you run beyond TSH? Because I know a lot of people are going to ask that.
Yeah, so within our standard testing at NutriChem, we test TSH, T4, T3 right off the bat when someone comes in. So we know it's thyroid stimulating hormone. It's produced by the anterior pituitary in the brain. It's like a gas pedal to our thyroid. So when our TSH levels are quite high, it means you're in a hypothyroid state. So it's like a pedal to the metal, and your brain is trying to get your thyroid to produce T4. On the flip side, in a hyperthyroid state, it's like the TSH numbers tend to be lower. So your foot's kind of off the gas pedal because your thyroid just kind of going nuts. And then what we also test, or what I test, is T3, which is so we test T4, which is T4 converts into T3, which is the active thyroid hormone. And then this isn't part of our standardized testing, but sometimes we test for it as reverse T3, which is then an inactive form of T3. Mm-hmm. And what's really important when we're starting to look at the thyroid hormone, and this is not taking into account the autoimmunity point, this is just basic thyroid, is understanding the ratios between TSH, T4, and T3. Because I think this is where, even when those three markers are tested, we miss imbalances or even subtle imbalances within the thyroid. So for example, with fibromyalgia, someone who has, so fibromyalgia is like a chronic pain, chronic state of inflammation where LDN does a great job as a therapy for helping to bring down that inflammation. But what I see when I'm treating fibro is that TSH levels tend to be a little bit on the lower side, because T4 tends to be on the higher side, and then T3, which is the active thyroid hormone, actually tends to be on the lower side. So we see this very different kind of ratio that's happening with thyroid hormones, where someone's, if their TSH was looked at, it would look at as being normal, if not tending towards the hyper side. But when we look at their T3, we can see that their T3 is low. That's the active thyroid hormone, which is actually going to give them the energy boost that they're looking to get from the thyroid. There are other endocrine, what do you call it, diabetes, where insulin resistance, where, insulin will decrease TSH levels. So there's an impact on that. And that in turn is going to slow down thyroid function. So there are other things that we need to look at. In terms of testing, which you asked me about earlier, there's Hashimotos as well. So Hashimotos is an autoimmune affliction to the thyroid. And in terms of testing for that, there's anti-thyroglobulin and anti-TPO antibodies.
Yeah. So, okay. So that's so as an ND, then you are running these. And why do you think there's such prevalence of autoimmune thyroid conditions right now?
Yeah, it's a great question. And so, I mean, I definitely have a bias towards the gut and gastrointestinal health, and hormones, right? And so when there's hormone dysregulation, we know that estrogen plays a role on thyroid. We know that diabetes, we look at metabolic syndrome, that has a role on thyroid. Cortisol, also, so high stressed individuals, cortisol, which peaks in the morning, can have a negative effect on thyroid when it's imbalanced. So there's like, you know, we're looking at today and the world that we're living in terms of this pandemic. You know, we're seeing a lot of fatigue and depression, but we're also seeing a lot of high stress to chronic fatigue happening and a lot of endocrine disruption. So
Mhm.
are you seeing that as well?
Yes, I'm definitely seeing that. And I think the thyroid, I think this is why we wanted to have you on and talking about the thyroid because, you know, like the other conversations we're having, LDN is such an excellent bridge to give, to kind of modulate the immune system to calm down the driving of autoimmune conditions. But at the end of the day, you do need to work on resolving those organ systems and reducing that inflammation from occurring in the first place. And I mean, the way that I always think about the thyroid is it's a very, you know, Adam and I were just talking about the ancient system of the endocannabinoid and the opioid system in our body. To me, the thyroid is so interesting. It's almost like a metabolic dial. And so when someone is so stressed out or there's a lot of inflammation going on in their body, your body will, like, even like you said, rising insulin levels, insulin resistance, your body turns down that metabolism in order to kind of go into a little bit of a hibernation mode to preserve energy. So it's quite interesting, that connection with the immune system. And then you have your body creating more inflammation, targeting the thyroid more. So,
Right.
so are you measuring that? So you're measuring it through antibodies.
Yeah. We measure it through anti-TPO would be the most common antibody that's quite elevated. And you know, when we're talking about uh, missing the autoimmune component to thyroid, you know, we'll see things like Hashimoto's where TSH is normal, and then you have what we call subclinical hypothyroid, so kind of plus some other symptoms like burnout and fatigue and all these other things. But then when we run the antibodies, we'll actually see that the antibodies are quite high, indicating the autoimmune component against the thyroid. And so then we'll look at things like, or I'll look at things in terms of like gut health, because that also plays an important role as well.
And so how do you refer for LDN in your practice? Or like, would Hashimoto's be something that you would work with another practitioner to potentially get a patient on?
Yeah, so unfortunately, at this point in time, LDN falls outside of my prescribing rights, so I'm not able to prescribe LDN. I do work with nurse practitioners, I do work with medical doctors who do prescribe LDN, who are familiar with LDN. And but what I do is because I can't prescribe it, the side that I take on as a naturopathic doctor is that I will then integrate things like desiccated thyroid into my treatment plans, where what I'm trying to do is quiet the thyroid down so that the autoimmune component against the thyroid becomes minimized. We use the LDN to help manage the autoimmune and the inflammatory portion of Hashimoto's. But then what we start to do is we start to look at decreasing the roots on the imbalances that's causing this autoimmunity within someone's body. And that can be done through diet. So, I mean, the number one thing is gluten and dairy, but we also have to look at the microbiome, and we need to look at gut inflammation because it plays an integrated role, which I'm not sure if Ken talked about it quite a bit. I was with patients, but I'm sure he talked about, you know, things like, you know, someone who comes in who's chronically constipated. We know that hormone clearance, estrogen is bound and excreted through stool. And someone who's chronically constipated will get estrogen levels increasing within their system, which in turn will do things like raise the amount of thyroid binding globulin, which then decreases the amount of active thyroid hormone in the body. So there are all these like different mechanisms that are happening within the system, where if we start to manage the digestion component, we're going to manage the proper regulation of the thyroid in conjunction with managing all these autoimmune and inflammatory responses that are happening within the gut, which are then going to balance all the thyroid hormones long term. It's kind of making it sound a little bit complicated, I think, but
No,
it's
but
like all these layers to it.
it's complicated, but it's not. And so do you see, when you get people coming in and with thyroid issues or fatigue issues, do you typically see a lot of gut health issues with them?
Of course, I mean, we know some of the classic symptoms of an imbalanced thyroid are gut-related issues, constipation, in some cases diarrhea. So, and we know things like the gut bacteria will help to convert T4 to active T3. So if you have an dysbiotic gut, that process slows down. And that counts for about 20% of the amount of T3 circulating around the body.
And so do you think that's why some people will respond to desiccated thyroid over synthroid?
So that's another great question. So synthroid is just T4, where desiccated thyroid, it's a glandular, it's T4 and T3. We have to remember is that our thyroid, it's like our TSH and our thyroid hormones are always in flux. They're changing. They're not really constant. And so the benefit of desiccated thyroid is that it's glandular, so it's going to mirror that kind of fluctuation. Where synthroid, which is there's nothing wrong with synthroid, it's synthetic T4 only. And so when synthroid is prescribed, we can see T4 go up, but the body still needs to convert the T4 to T3.
Mm-hmm.
And so that plays into the role of like gut health and then all the cofactors needed for that as well.
Right. And I think, again, that's kind of one of those things that we could do a whole talk on desiccated thyroid, just like we're doing one on LDN, is it is kind of more of, it has a little bit more controversy, I would say, because it can be a bit more difficult to manage in practice, but it's interesting clinically the results that people get using desiccated thyroid over synthroid and understanding that there's other things that need to be addressed. Why aren't you converting your T4 into your T3? What else is at play that you would respond to one and not the other? And some people respond really well to synthroid. I think it's just opening up that door that there's more that we need to understand.
I couldn't agree more. And I'm sure you see this in practice as well. There's some people who do better on synthroid, and there's some people who do better on desiccated thyroid. It's,
And so your bio had a lot about, and the next speaker that we have on Kim Rovers, we're actually talking about LDN and digestive conditions. So I don't want to get too into digestive conditions, but I think it's a clear reoccurring theme, and everybody's noticing, okay, this is a conference on LDN and we keep talking about inflammation and gut health, but I think that should show people how important it is to address. So what is it that you're doing to address immunity and inflammation and gut health, from a naturopathic standpoint? Because I do think a lot of our listeners right now, potentially in the LDN world, may not have seen a naturopathic doctor in the past. So they might really not know what it is we do, specifically in Canada, and how else you can support someone's body while it's going through a journey of managing a complex condition.
Right. Well, I definitely have a bias that our root of health is in digestion. It's how we absorb our nutrients. It's how we process our food. It's, majority of our histamine is made, histamine is made in our gut. Galt cells, which make up the majority of our immune system, are within our intestines as well. And what we know is that when people aren't digesting their food properly, or when they have chronic bowel related issues, they have chronic inflammation within their intestines, it kind of has this cascade effect on the rest of their body.
And so how would that come into play? Because in terms of the thyroid, what do you typically see in a patient where there is a low thyroid involvement?
When there's low thyroid, meaning hypothyroidism?
Yeah, because I think a lot of people, we know a lot about it because we're in the realm, we're in the clinic, but I think there's a lot of misunderstanding about what it is that the thyroid does and how potentially a low thyroid function can impact somebody.
Yeah, and so that's a great question. So what we need to look at when we're talking about gut health, and we're talking about the thyroid, is that T4 and T3 actually play a role in managing the inflammation within the lumen of the gut, right? So T4 has this anti-inflammatory effect. So if you're producing low amounts of thyroid hormone, you're going to be more apt to having inflammation within your intestines, which can lead to, you know, bloating and pain and those kind of abdominal discomfort symptoms.
Right. Okay, so I have another question here. I know that some Hashimoto's patients end up reducing their thyroid medication once LDN starts working, but
Right.
I'm already on a very low dose because I can't even handle an average dose. I have cortisol issues interfering with my thyroid medication and cannot raise my thyroid dose. Hence, I am symptomatic. Have you had people tolerating higher doses of thyroid medications once LDN starts working?
That they've tolerated higher doses of, of thyroid medications with the LDN.
Mhm.
And then the dosing of the thyroid medication when it was too high was causing, I'm assuming, hyperthyroid type symptoms.
Mhm.
Is that what the person is saying?
I think so, yeah.
Okay. I I have I seen that? Yes, for sure. Because what we can see is that the autoimmune and the anti-inflammatory side, I think for the most part, actually, I would say the opposite is that when LDN kind of kicks in, I most of the time will actually see a decrease in my case, it would be desiccated thyroid, that the need for desiccated thyroid actually decreases. Um,
Right,
over
exactly. And I think that's why people are looking to use it because you see Hashimoto's, when you see Hashimoto's, I think it's really interesting from a clinical standpoint because Dr. Junik and I were talking about this. It's really hard to see on paper certain markers of autoimmunity. Hashimoto's, when you're looking at TSH and T4 and T3 and anti-TPO levels, you can see mass swings. The dose doesn't change. There could be flares going on, stressful life situations, sleep disturbances occurring acutely, menopause coming on, and all of a sudden their TSH levels bottom out, like go 0.01, and then we just slightly modify their dose, and then they go through the roof.
yeah,
And so to me, that's not a dose problem. That's an inflammation, autoimmunity. That's why the LDN is such an integral part of this conversation, is because we cannot chase dosing based on blood work for Hashimoto's, or else you will just be swinging all over the place. And so you do need to target the gut, autoimmunity, bringing in things like LDN, especially when it's very difficult to manage. So I think that's a really great question that was asked, because I did think it highlights that point.
right. Very much so. I couldn't agree more.
Raise their medication once on LDN. Right. So they're just asking if, dose raising or versus dropping. But I think the point we're getting at is that we don't want you on a high dose just to be on a high dose, just to get lab values. It's about how you feel and making sure you're in a safe range.
Right. And making sure that the antibodies are being tracked and reducing,
Mhm.
right? And then with the LDN and the antibodies reducing because the anti-inflammatory and the immune regulating benefits of LDN, it's also, it's starting to modify the dosing of any thyroid medication that's being prescribed. There are also like natural, there's botanicals that are also integrated into my Hashimoto's treatments. That also, there's studies that show that they support the TSH4, T3 production through Hashimoto's. They decrease anti-TPO antibodies against the thyroid. So they have a similar but not as strong effect as LDN. But the plant is called Nigella satin. It's a black seed, black human seed. It's an Ayurvedic herb. And I mean, there's a lot of evolving research that's coming out of that as well. But that in conjunction with LDN tends to work quite well.
Yes, like black cumin seed is my new obsession.
Yeah. And it's like this magic herb where they're, for traditional use, it's used to like lower blood pressure, metabolic syndrome, which is a lot of what I was talking about earlier. So it's like regulating insulin, decreasing cholesterol. It's like working on that full event system, the metabolic side. But then there are studies out there that show that black cumin seed in certain doses will support TSH, T4, T3, and also lower the antibodies within 8 weeks of taking it.
Yeah, because it does have that immune, it works, there is such an immune modulating effect. And so one other question I want to ask you, why do you think that women are so susceptible? I know you touched a little bit on the estrogen side of things. Why do you think women are so susceptible, or do you have a thought on that, why they're so susceptible to thyroid conditions?
Yeah, and it's what I meant. Like the main reason in my practice that I see is, decreased thyroid hormone causes constipation. Constipation can lead to the reabsorption of estrogen. High levels of estrogen within the body then decrease thyroid function. So it's this pretty nasty cycle that seems to happen, which is why earlier I was talking about the importance of managing digestion and making sure that the metabolization of hormones and the excretion of hormones through stool is something that's on the table whenever we're talking about thyroid hormone.
Right. And I think you're kind of getting into play that there's also so many estrogens in the environment, in our food, xenobiotics, all that sort of thing that are hitting estrogen receptors. So we do see women overcome with estrogen symptoms sometimes, and we don't even think about the role that has to play on all of our other systems.
And this is where like liver plays a huge role in that too, and modifying, like basic things like don't drink out of plastic, don't microwave or use plastic containers. I mean, these are all those xenoestrogens that you're talking about. And it's funny that I love that you're bringing this stuff up, Emma, because now I kind of am taking it for granted. I'm talking to you, so I feel like I'm talking to another clinician. So I'm like forgetting about all these things. So I love that about you, that you can just kind of pull it back in and be like, well,
Yeah.
I appreciate that. I totally appreciate it.
Oh, it's a great chat. I love these discussions. It gets, good conversations flowing. We do have one more question. I think it's really interesting. Does LDN help with Graves' disease? And if so, what other substances would you suggest be taken with it?
Okay, yes. So there is some research first of all, I don't see a lot of Graves' disease in my practice. So I just want to preface what I'm about to say. There is research that supports that LDN will help with the anti-inflammatory and the antibodies against the thyroid, the TSH receptors. For Graves, there are certain herbs from a naturopathic perspective, like Melissa officinalis, probably saying that wrong. Then there's also working on the AIP, so you're working on an autoimmune diet, so you're reducing that autoimmune component to it as well. Do you have anything to add to that, Emma?
I was going to direct you. The LDN Research Trust, as we've learned from today, has so much research on all the conditions. It's almost like the compilation of any condition that we can think of. So I definitely direct you there for that specific question. But, just along the lines of mechanistically, it would make sense that calming down inflammation and immunity potentially would have a result. Graves is a little different though, because it is, when you're putting yourself into a hyperthyroid state, there's a lot of other, implications that need to be looked at. So there's going to be more of a risk benefit treatment of allowing yourself to potentially stay quite hyper for a while. But you definitely, there's a pendulum for sure with the thyroid, and you see the swings either way. So that's my answer to that for now. Well, that was great. Thank you so much, Dr. Yousuf. It was excellent having this discussion. And again, I think this is a perfect lead into our next conversation, because it is going to be more diving into LDN and gut health. So I appreciate you being here, and have a lovely rest of your day.
Thanks, Emma.
So next up, we have Kim Rovers. She's a nurse practitioner.